Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Syphilis is often called the great imitator because its symptoms can mimic many other diseases. This can make it difficult to diagnose. Untreated syphilis can have severe consequences, affecting the heart, brain, and other vital organs. It can even be fatal. The good news is that syphilis is preventable and treatable, especially when caught early. Syphilis is a sexually transmitted infection, or STI, caused by a bacterium called Treponema pallidum. This bacterium thrives in warm, moist environments, making sexual contact the primary mode of transmission. Syphilis spreads through direct contact with a syphilis sore, also known as a chancre. These sores often appear on the genitals, but can also develop in the mouth, anus, or other areas. It is important to remember that syphilis can be transmitted even if no visible sores are present. Syphilis can also be passed from a pregnant woman to her unborn baby. This is known as congenital syphilis and can have devastating consequences for the child. Pregnant women should get tested and treated for syphilis to protect their health and the well-being of their babies. Syphilis progresses through several stages, each with its own symptoms. Primary stage, 3 to 6 weeks after exposure. A painless sore, chancre, appears at the infection site, genitals, mouth, or rectum. The sore heals on its own, but the infection remains in your body if untreated. The next stage is the secondary stage, weeks to months later, with rash, often on palms and soles. Flu-like symptoms, fever, sore throat, swollen lymph nodes. Mouth sores, hair loss, and muscle ache. Symptoms may disappear, but syphilis still remains. Latent syphilis, hidden phase, years later, can last years, silently causing damage. No symptoms, but the bacteria are still in the body. It can remain dormant for years before progressing. Tertiary syphilis severe complications years later can damage vital organs, leading to severe complications. Brain and nerve damage, neurosyphilis. Heart problems and organ failure. Blindness, paralysis, or death if untreated. Diagnosing syphilis involves a simple blood test. This test detects antibodies that your body produces to fight the infection. Early diagnosis is crucial for effective treatment and preventing long-term health complications. There are different types of blood tests for syphilis. Your healthcare provider will determine the most appropriate test based on your individual circumstances. These tests are highly accurate and can detect syphilis even in its latent stage. Blood tests to detect antibodies against syphilis. Microscopy for checking fluid from a syphilis sore. Lumbar puncture, spinal tap. If neurosyphilis is suspected. If you are sexually active, especially with multiple partners, regular syphilis testing is essential. The good news is that syphilis is curable, especially when detected early. Penicillin, usually administered via injection, remains the most effective treatment. The dosage and duration of treatment depend on the stage of the infection. If allergic, other antibiotics like doxycycline may be used. Early treatment can prevent the progression of syphilis and its devastating consequences. Preventing syphilis involves adopting safe sex practices. Using condoms consistently and correctly during sexual activity can significantly reduce the risk of syphilis transmission. Limiting sexual partners and reducing the number of sexual partners can lower your chances of encountering the infection. Open communication, having honest conversations with your partner or partners about sexual health, and getting tested together. Regular testing if you are sexually active, especially with multiple partners. Syphilis is curable, but if left untreated, it can cause irreversible damage. Early diagnosis and treatment are key. Please don't forget to like, subscribe and share. Thanks for watching.